All right. Well, welcome to today's podcast. I have the pleasure today of interviewing Dr. Austin Bergermeister. He's in Charlotte, North Carolina. Beautiful place. All right. Your practice is pretty awesome.
I
You've
appreciate
got a lot of modalities, a lot of things going on.
that.
How is it that you ended up in that place as far as having more than just back cracking? I see some chiropractors that are kind of stuck in that, others that are embracing so much more like you have.
Yeah.
How did you end up with that kind of suite of services?
So when I was in undergrad, I was shadowing a bunch of different offices, fell in love with the sports medicine aspect of chiropractic, where they're doing a lot of soft tissue therapies, rehab, along with the chiropractic adjustments too. When I was coming out of chiropractic school, I was looking around for an office to go ahead and either be an associate in, work in, or at least model my practice after. And especially in this area, there wasn't a ton of offices that kind of did everything that I do in my office, like the soft tissue therapies, the dry needling, scraping, neurokinetic therapy. And so I wanted to create a place where it wasn't just the insurance model where it's the quick 5-second adjustments, but basically looking at your health overall, and then being able to provide the best care that I can for my patients as well. And that's something that when I was getting treated in undergrad for chiropractic, that made a huge difference in my rehabilitation and getting back to where I wanted to be. Not only did the adjustments help immensely, but being able to get that soft tissue therapy as well definitely was a game changer for me and helped me. So I want to be able to kind of spread that for my patients.
Something I get watching your social media, which by the way is awesome. And it's a pretty far reaching, doing a heck of a job there. What I've noticed is more than, just back cracking, and it's more like primary care. It's more like you're managing the engagement with the patient rather than having a patient simply show up for the quick adjustment, disappear for 6 months.
Absolutely.
Some of the modalities are a little different.
Yeah.
I don't see these very often. For instance, dry needling. Let's start there. Most of our folks, by the way, for our company, we do a lot of topicals for managing pain, chronic pain, fibromyalgia symptoms, joint issues.
Yeah.
And not enough of our customers, our following, understand dry needling, which is a little different. They see acupuncture, and I've had a bunch of that. I've also had dry needling, and they are similar, but also different in some pretty cool ways, especially the dry needling.
Absolutely.
What does that help with, the dry needling?
Yeah. So the dry needling will directly go affect trigger points in muscles, tight areas of muscle. It also affects the fascia, which is basically a coating between our skin and our muscle that coats the entire body. In that fascial layer, especially through stress, repetitive traumas, or injury, or anything like that, it creates adhesions, which are almost like a scar tissue, where it will limit the glide between the skin and the muscle. It will basically retain fluid in that region as well. So basically, the dry needling will go ahead and attack tight areas of tissue to help release them. It will also help release some of the fascia as well.
When you do the dry needling, is it full body like with acupuncture, or are you focused in a particular area or two?
Yeah. So with the dry needling, we're a little bit more problem focused or problem oriented. So we're looking directly towards a specific issue. So typically when I do the dry needling, I will go towards that either extremity or part of the body where they're experiencing that tightness. It's not going to be needles all over the place like you see with acupuncture, but basically I'm going directly to that source and going ahead and trying to get a release through that.
Some folks have a real fear of needles. They think this is going to be a painful, invasive, difficult thing.
Yep.
I have not found that to be the case.
It is not like you're going to the doctor, you get a shot in your arm. It's not that type of needle whatsoever. It's very thin needles. You rarely feel it go in. When it is in a tight area of tissue, you might feel that muscle tend to tighten up a little bit more. But basically, that's the most pain that you'll kind of feel when it's occurring. Typically, I tell patients all the time, it's like me kind of grabbing onto a muscle or putting sustained pressure there for a period of time as well. And then basically, once we start impacting that fascia as well, you'll feel it tend to tighten up a little bit. You might feel that area guard for a second, but then we'll just let that area sit for a while, and then it will help release that area.
Okay. Why do we need to release that area? Why is it problematic if somebody has some tightness, maybe a strand of their quads they just won't let go? What's the downside of not addressing it?
Yeah. If you're not addressing tight areas of tissue, there's going to lead to dysfunction down wherever it's going to go. So either down the kinetic chain or into different movement patterns and things like that. If we don't go ahead and release tight areas, and muscles can be tight for two separate reasons. They can be tight because they're basically overworking, or they could be weak, and that's why they're tight as well. So being able to go ahead and release those muscles will help the function of that area of the body get a little bit better as well. So then you're able to utilize those muscles that were meant to basically do those jobs a little bit more. So then it will decrease some of the compensation that's occurring in the body.
And it's that function some people miss out on. They don't understand that you can have one tight muscle that will spread, not so much the joy, but spread the problems if it's not addressed.
Absolutely. And that's why I was always taught, do not chase pain, because that can also lead to kind of different areas. If you're chasing your tail around, trying to find those areas of pain, it can actually be originating from somewhere completely different as well.
Way back in high school, I was working with a sports doctor, actually for the local university, Boise State University. He was there, orthopedic surgeon. I had knee issues.
Mm-hmm.
And he was letting me chase the pain. Going into high school basketball, my senior year, he was able to give me some prescriptions to take care of the pain.
Mm-hmm.
I can't remember now what it was. It was either an NSAID or actually it seems like it's
Also
or
relaxer.
something. Back then, well, it was all pain driven. Unfortunately, once I had to go off the meds about mid-season, we found that I was just tearing at my knee. We were treating pain without treating function.
Mm-hmm.
So we masked the pain, took care of that, chased the pain symptom. And because we didn't address function, I was actually chewing through the cartilage in my knee and didn't know it.
Absolutely.
Not a great way to approach any of the body management.
Absolutely not. I totally agree with that.
All right. Also on your list, you do something interesting with extremities. I think a lot of folks, well, they don't understand. They're not aware that there's more to chiropractic adjustments than just working on the spine, which is awesome. I get that pretty regularly, but there's more that can be done. What is this extremity adjustment thing?
So extremity adjustment, it's everything non-spinal. So everything outside of your spine, whether it's shoulder, elbow, wrist, knee, ankle, foot. Basically, there's bones all over your body. There's joints between each segment of bone on bone. And basically, sometimes that can also get misaligned as well. It's not just your spine, but it could be the extremities as well that's causing some interruption in the function of that part of the body as well. So kind of going back to function, definitely we want things to be properly set in their resting position without interference on the nervous system as well. And it doesn't have to just be interference on the nervous system coming from the spine. It could be interference kind of coming down to an extremity, which is causing some difficulty, whether you are kind of turning your wrist or anything like that, can lead to elbow pain, shoulder issues. So definitely, I always love to do extremity adjustments as well, making sure that basically every part of your body is functioning to its optimal potential as well, which is going to help the nervous system out too.
How do you know if I need an adjustment in my knee, for instance?
Yeah.
Can you test for it?
What was that?
Can you test for it? Could you figure it out before, or you just start working through the body and adjusting everything?
So definitely you could see, especially through chiropractic care, we were taught to look at each joint individually. We were taught how to palpate, which is feel around in the joint space as well. So you can actually feel restrictions in different areas as a chiropractor. So basically I'll go around feeling either comparing left knee to right knee, or if they have a problem on that side, I'll go ahead and actually start testing out, feeling around for different regions, feeling for the motion in that joint as well. And then if they have a restriction in that area that I do feel, then we'll go ahead and adjust that accordingly.
Did you learn that in college, or was that post-college as far as the extremity adjustments, or is it both?
So it's in chiropractic school, which is kind of in your postgraduate degree, which you're eventually getting your doctorate of chiropractic. And so we learned a little bit through there. Definitely in school, they don't teach you everything that you need to know. So there's definitely continuing education that I go out and do. I basically have to go ahead and do a certain amount of hours per state per year as well. So basically finding something that you're interested in is usually the best thing for that. But then you go to these continuing education seminars. So they're teaching you how to go ahead and see the problem and then go ahead and address that as well.
All right. I assume those are being taught by other chiropractors, the continuing ed. So somebody's teaching extremity adjustments.
Yep. Yes, sir.
Okay. Got a fellow I go to, another chiropractor in Boise, Idaho, that actually teaches extremity adjustments.
Yeah, that's awesome.
And when I get in trouble, I have to make the trip to Boise so I can get that done.
Yeah. How far are you from Boise?
About 20 miles.
Okay.
All part of the same
not
valley.
too
It's all kind of growing together.
Yeah.
Good place.
Yeah.
All right, as far as the extremity adjustments, I can see that it would be important for college athletes, pro athletes. What about your weekend warriors?
Oh, absolutely. If you're doing high intensity interval training, you're basically getting out of the desk to go be active. there's going to be some sort of dysfunction in a particular movement as well. There's stress that's added on the body every single day, whether it's chemical, physical, or emotional stress. That plays an impact on how your body stays aligned as well. So basically, going through those stressors in life will pull you out of alignment, making sure that we are keeping you in alignment, making sure that we are helping the nervous system function to its optimal potential. It's going to help not only the weekend warriors, it's going to help infants, it's going to help pediatrics, it's going to help geriatrics, it's going to help pregnant women as well. So basically, it all falls back to the nervous system, helping the nervous system function, because everything has to pass through your nervous system in your body, whether it's organ function, sensory information, or motor output.
I was going through social media yesterday, and there was a post just made me jump to a different thing, the weekend warrior, but more of the actual pro athlete. Something you said in one of the posts reminded me of an interview that I heard many, many years ago from John Stockton. He might be a little too far in the past for, who, actually, do you know who John Stockton is? He played for the Utah Jazz. He played from like 84 to 2003, 4, something like that. Played into his early 40s.
Okay.
He was being interviewed. I had to go look up this interview. It just sparked a memory. He was asked how it was that he had played so many seasons into his early 40s in the NBA, which is quite a grueling professional sport to be involved in. And he was asked, how is it that you're still able to do this and you miss so few games? And he was very durable. I was a Jazz fan back in the day, went to some of the games, loved watching John Stockton, Karl Malone. What was interesting was the response. He didn't start with, oh, I'm awesome, I train well, I've got all these gifts, I've got this awesome workout or this awesome nutrition plan. The first thing he mentioned, I see my chiropractor at least weekly, usually more often, sometimes 3 times a week, to make sure everything's aligned so I have good function, so that I can actually perform and not run my body down. Absolutely. Which was really interesting to hear from him. And I didn't quite appreciate it 20 years ago. I appreciate it now.
Of course.
Much more now.
Yeah.
But back then I didn't have quite as many, creaky joints, aches and pains.
A lot of professional sports seek out chiropractic care.
Yeah. A lot of sports teams now have full-time, or at least the designated team doctor. I know a guy in Utah that does it now, Chris Bailey, same last name, no relation, but awesome guy. And he's big into the extremities, fascia, or the dry needling. And he works with some of the college teams and a couple of professional teams. Mm-hmm. Similar practices to what you do.
Yeah. And if you look back at, I think Tom Brady, Tiger Woods as well, if you go back and look up like a chiropractic quote from them, they say the same thing. Tiger Woods said that it's just as important as his training to go seek his chiropractor out as well. And Tom Brady also was something very similar as well, where he's saying, I could go ahead and be able to do this and use my body because I'm actually going to my chiropractor as well. So I like to always say that your body's like a car. You have one car for the rest of your life, though. Are you going to take care of it now, or are you going to wait for it to break down and then have a lot more issues going on later on down the
road? Yeah, great analogy. Now with my car, I've got a little sticker that says every 3,000 miles, I need an oil change. Yeah. I don't have a sticker for my body. If I'm in reasonable health, I assume I should still do regular maintenance. How often? How regular? What's a general recommendation for maintaining the body through chiropractic?
So that's definitely different for everybody. Everybody's a little different. What they do is different. They have different stressors in their life as well. Typically, on an average basis, I would say anywhere between 1 to 4 weeks would be a good time to go ahead and get regular maintenance done as well, because you're using your body every single day. Stressors don't stop in your life, and you're going to get pulled out of alignment. So making sure that we go ahead and fix those issues before they become problems down the road is always being proactive about your wellness rather than reactive is better.
Yeah, it's much better than waiting until you're in desperate shape.
Oh, yeah.
And with age and injury, probably a little bit more frequent visits would be highly recommended. Like, I'm to the point, I've been through 20 orthopedic surgeries, a few broken bones, a couple of fractures in the back, and I get body work at least every other week. Mm-hmm. If I don't, things get kind of ugly.
Your body will get cranky.
Yeah, it does get cranky. Absolutely. Hey, I want to jump back to fascia. This is another area that's not discussed enough, not understood well. In my case, I've had a bunch of knee surgeries, foot, ankle, back, shoulders. What happens with the fascia in the event of a surgery? Especially in my case, I've had knee replacements about a decade ago. What happens to the fascia, and what do I need to do post-surgery to help maintain and prevent additional problems?
Yeah, definitely. So after you have like a surgery or an injury to that area, the fascia becomes affected. And basically that fascia ends up turning out to become like a scar tissue. Becomes very rigid. It doesn't allow proper fluid motion underneath the skin. It doesn't allow proper glide between the skin and the muscle as well. So basically, after surgery, it's definitely important to get fascia work done. And so you can do different things for that, such as a lot of the soft tissue modalities that I do. So the scraping or Graston technique is really great. The same thing with the dry needling too, where you're actually affecting the fascia to help it release. If you don't ever help that area release, it's going to be restricted in some range of motion. It's going to be impacting that joint or that particular area of the body as well.
Graston scraping.
Yep. Sounds pretty.
What is Graston scraping? Another fun modality
Yeah.
that I get a lot of benefit from.
Yep.
And it's a little hard to find a practitioner skilled, trained in Graston. But you are.
So it's different. So being trained in Graston, you actually have to go to a continuing education seminar for the Graston technique and become certified in that. I'm not certified in Graston, but throughout chiropractic school, I was teaching in our soft tissue club. So I was teaching other students how to go ahead and perform these techniques. So we call it instrument assisted soft tissue mobilization. Very similar things that are going on. So you're still using that stainless steel tool. You're still affecting the fascia, the grittiness that's underneath the skin, the scar tissue buildup as well. We're basically trying to break that up utilizing that tool. So we're bringing inflammation to that region, which everybody's always like, oh my gosh, inflammation, that's bad. Sometimes bringing inflammation to that region is going to bring new blood flow, new cells to that region, which is going to help clean that area up and lay new cells down and new tissue in that area.
So inflammation, not necessarily always bad.
Yes, I'll be cautious with saying that, but yes, that's true.
Okay. How about general inflammation?
So general inflammation's not great. So if you have inflammation going on systemically in your body and you're not doing anything, you're not bringing inflammation to that region or anything like that, that's when it's not good. But with what we do in our techniques, in our solution where we're bringing blood flow to that region, which is bringing inflammation to that region, that's good. That's going to help basically clean up that old tissue, lay down new tissue.
And we've got topical products that we use. One of the key ingredients is dimethyl sulfoxide, DMSO. Among other things, it's a vasodilator. So that we can move the good stuff in and move the crap out, because you've got to have the blood flow for healing.
Yep. That's why.
And often, especially with a grizzled old body where I've had 13 knee surgeries, I've got so much scarring and damage to the fascia that I need that extra boost to be able to get the blood flow, to be able to also get the waste out.
Yeah, of course.
It'd be a heck of a challenge.
Oh, yeah. That's why heat's always good, too, after injury has occurred. So directly after injury has occurred, ice is always better, just because that's going to slow down inflammatory processes. However, a couple days down the road, heat's always going to be a little bit better because it's going to bring blood flow to that region, which is going to help with that healing process.
How long do you keep the ice going after an injury? Hour, days?
So basically, when you are icing a particular area, I always say try to do it for 20 minutes on, 20 minutes off, and repeat that process about 3 or 4 times that day as well. If there is something where it is a nerve-related injury or you just really want numb pain, then you can go ahead and use ice for those reasons. But basically, bringing blood flow to help relax muscles, relax tissues, help bring blood flow to that area is going to be better for you utilizing heat.
Back in high school, I had quite a foot injury. Again, playing basketball, and I wanted to keep playing. I think the statute of limitations has run, so I can share my story. During lunchtime, I'd find a way into the training room in the gym. I had the gym in the lock, had a way to get in. I would do contrast baths, where I'd put my bad foot, bad ankle into a whirlpool full of ice, just floating around in ice, and then heat, back, forward, back, forward. Why does that help relieve pain? I got a lot of relief.
Yeah.
Don't understand.
Well, the ice, it's going to act it's also going to vasoconstrict those areas. So it's going to reduce blood flow going there. The ice is also going to help basically override the pain receptors that are going to your brain. So you can have pain receptors and feel receptors and mechanoreceptors going to the brain at the same time. So basically, once you start icing that area, it's going to numb that pain out for you. So you're not necessarily feeling that. Once you then go ahead and jump to basically that heat right after the ice, that's going to rush blood flow to that region too, which is going to be more beneficial in the healing process itself. And then basically that ice is there to kind of numb or dull that pain.
All right. Well, it kind of makes sense. All I knew was it worked. I don't recall now why I thought of that. That was decades ago.
Yeah.
But it got me relief, ton of relief.
Well, absolutely.
Yeah. That was back in my days before chiropractors, before doing all of this extra good stuff.
So what was the first time that you went to a chiropractor?
Actually, my first adjustments, this is back in college, back in law school days.
Mm-hmm.
And I was seeing Dr. Jeffries, who was a DO, but he'd been blind since the age of 13. So he went through and got his doctorate in osteopathy and was adjusting. He was awesome. And then as far as a regular chiropractor, it was just a few years after that, working on our house, laying carpet, doing some things after college. I created quite a mess with my back, went to see a doc. And I told him the area that was really bad, took x-rays, and he said, no wonder, this is a broken vertebrae here that healed crooked. Here's another one here that healed crooked. And that's when my chiropractic journey really started.
Yeah, absolutely.
And now if I don't get regular adjustments, regular help, things get kind of tough.
Mm-hmm.
I've got too many things that are just odd. Plus, having the surgeries is difficult. I've had fairly invasive surgeries, unfortunately.
Mm-hmm.
Some that made sense, some not so much. And now I just get to deal with that. And fortunately, I've got a good team that I get to work with. So a good naturopath, a couple of good chiropractors.
Awesome.
Depending on what my need is. Yeah, they keep me going.
Definitely.
Which is, I've still got a lot of things to get done.
Like a well-oiled machine.
I need to be. And actually now, I'm almost 60. I do more things now that I could do at 40.
That's awesome.
Yeah. It is awesome.
Mm-hmm.
Really awesome. Hey, when patients find you and they go to the office, what do they experience? How is the intake process? What do you go through, or what do they get put through so they can be properly diagnosed?
Yeah, absolutely. So basically when they first come on in, they've already filled out an intake form online. So it goes over their health history, something I could review before they come into the office. Once they come into the office, then we're basically going through a thorough history. So I'll be asking them questions, not only about the situation that they're dealing with, when it happened, what makes things better or worse, but then I'm also getting into kind of the nitty gritty. So things that they're doing outside of their or during their normal occupation or at home, things that they've tried before. And then once we start getting done with the history, I love going over goals with patients too. This is something that we could go ahead and try to strive for or aim for by a re-exam. And then after that, then we'll go kind of into a little bit more of kind of the hands-on portion. So we're going through orthopedic tests, neurologic tests to check out the nerves. And then after we go through ranges of motion, posture screens, orthopedic tests, then I'll have a better understanding of what's exactly going on in the body. I'll go ahead and explain that to my patients as well. But I never really like putting a label on the patient care other than doing it for kind of notes process, the notes process. But basically, I don't ever like keeping people inside of a box or contained in a box. So I tell them, I let them know what's going on, but at the same time, I know that we'll be able to work together and help them out to reach their goals as well. And then basically at that point, then we'll go ahead and dive right on into treatment if it calls for that day. If something comes up where I think we need to go ahead and refer you out for imaging or anything like that, then we'll go ahead and do that too.
Something that's important here, and this is really for our following, folks that are watching this, that diagnosing, that long diagnostic process is critical. It's everything. I've occasionally had to go to chiropractors when I've been on the road. There's a national chain. Occasionally I will hop in. Mm-hmm. There's no diagnosing. It's just whack, crack, and I'm on my way.
Yep.
And maybe that's all right when I'm on the road, but it's not a great way to get comprehensive care.
Oh, of course.
That diagnosing is everything as far as the care.
Yeah, you could be running around in circles, chasing the same thing if you don't have a proper working diagnosis either.
Plus, it's critical you're spending the time. That's awesome. Got some buddies that are MDs, and they're kind of frustrated now with their practice model because it's largely dictated by, well, really by the pharmaceuticals and the insurance. Mm-hmm. And in their case, I kind of tease them, but they agree. I tell them they've got 4 P's of practice: poke, prod, prescribe, and push them out the door because they've got to get to the next patient. They can't, in the normal MD model, they can't spend time with the patient. They don't have time for a lot of that diagnosing. A lot of that falls to the trained medical staff, the nurses, the PAs. And that's not awesome. I think that's one of the reasons we're seeing poorer outcomes through allopathic medicine. They're not getting the diagnostic time that's really needed.
Mm-hmm. And then they're just slapping a Band-Aid fix on it most of the time.
Yeah. And they want it to fit into, well, a Band-Aid, a pill. It's got to be something quick. It's got to be something easy. And it's got to fit a protocol rather than a real practice of medicine. And that I think people are being shorted.
Mm-hmm.
Yeah, it's unfortunate. I see a naturopath. When I see her, I get a minimum 30 minutes each time, sometimes longer, minimum 30, so she can actually diagnose, figure out what the heck's going on.
Yeah. And that's a game changer right there.
It is.
I have patients
Yeah.
come in all the time. They're like, I've never had a chiropractor spend this much time with me on our first visit, or actually look into what's exactly going on either. That makes
Did you counsel them on nutritional practices?
Yeah. Yeah. I mean, so basically I'll do anything in a holistic manner. So I will look into their diet. If there's something that I can go ahead and recommend, whether it's a supplement or anything like that, I definitely will. We'll look into what they're doing for exercise outside of the clinic. I'll go ahead and give them some tools that they could go ahead and use when they're not in the practice as well, just because you spend a lot more time outside than you do with me. So basically being able to help them through that healing process and giving them activities and things to do at home to help basically kind of push that along will definitely help.
What are some of the common problems you see in nutrition? People coming in, they're in pain. You start probing to find out how they eat, what they do. What are some common red flags?
High sugar intake, always.
Mm.
Sugar intake is always just going to go ahead and throw more inflammation into the body. And that's the not so good inflammation that we were talking about earlier. So basically, that's just going to go ahead and basically make that area agitated, swollen. It's really going to take a long time for that healing process to continue working as well. If you're just kind of feeding your body with not so great things, a lot of processed foods too, really not good for you. I'm always talking about like the chemical form of the chemical stressors that are occurring in your life too. So processed foods are definitely one of them. You could also look at organic versus non-organic foods and basically what they're spraying on the foods, pesticides, things like that, things that you probably should not be putting in your body, but people are putting it in their body.
It's interesting going to the grocery store to see the percentage of the store dedicated to processed foods versus whole foods.
Oh, yeah.
Because a general rule, it's kind of nice to just shop the outside,
Mm-hmm.
avoid the inside as much as you possibly can. That's where all the processed foods seem to be.
Mm-hmm.
And yet that's the majority of the American diet.
Unfortunately.
It's so distressing to see statistics. We are the wealthiest nation per capita, and our health outcomes are declining despite the wealth.
Definitely.
And I think a lot of that's based in the diet, based in what we're putting into our bodies. And then we have to turn to guys like you to try to fix our bad habits. Oftentimes, we don't want to give up those bad habits. I don't want to give up my sugar. I don't want to give up my potato chips or whatever my advice happens to be.
And that's why that education portion of treatment is super important too. Letting your patients know exactly what's going on, what's happening in their body too, and why it's playing an effect in their life. That's why it's super important. That's why I try to always save some time and always have enough time for treatment to go ahead and educate my patients, ask them if they have any questions or anything like that too. And I feel like a lot of people aren't really kind of sitting in front of their patients and asking them those questions too.
Yeah, I think that's true. Not so much in chiropractic, certainly in mainstream medicine. There's no doubt about that. Just not taking the time. Hopefully in chiropractic, we do better. I think I know quite a few chiropractors that are just plain awesome. They take the time to get it right, which is critical. What age of folks do you like to focus on? Do you have a particular interest, a particular area?
So I love always working with families. It doesn't really matter to me the age group or the age range. So I'll treat anyone from infants, day-old infants, to the elderly, and anyone in between. Since I played sports as a kid, I love always working with athletes as well, or even just the weekend warriors that I was talking about earlier. But basically, anyone who is active, it's super important to make sure that you're aligned, just to continue going through that activity and making sure that the wear and tear that you're putting your body through isn't going to play an effect on your body. Same thing with people that work at a desk. So I really am just your family chiropractor. I like working with the whole age spectrum, but basically anyone that's either dealing with pain, who's health oriented, I just want to help them get better, feel better, and live better for a long time.
You mentioned sitting at a desk. A significant portion of us do that professionally. Sit at desks, sit in front of computers. What's the downside? What's the harm of just sitting at the desk?
Well, posture plays a huge impact on the nervous system. Your body's going to start developing patterns too. You're going to start tightening up in different areas. You become basically, there's different kind of realms that can get caused by that, but basically tight hip flexors can get caused from that. You can have upper cross presentation where you have tight pecs, rounded shoulders, head coming forward. things to that extent too, which puts a lot of stress on the upper back and lower part of the neck as well. And a lot of people don't really realize that always looking down on your phone is probably not the best thing. Our necks actually start straightening out. We don't have that proper cervical curve for our neck, which is going to help take that compression from gravity down on our spine as well. So then it's going to lead you to looking like you have your head in front of your shoulders for when you're 60 years old, and it looks like you're going to fall over. You can't even look up or stand up straight.
I've had quite a few friends dealing with low back pain. I didn't understand this until I dealt with my own low back pain. Went to see my doc, and he explained that's a sitting problem, and it's a hip flexor problem. I was doing all kinds of things to stretch my lower back, with no relief. Until I finally got a professional to explain that it was the hip flexors from sitting. Of course, they get shortened while I sit. How does that affect the lower back, and why is that such a problem with folks that are jockeys like me?
Yeah, well, when you're sitting for extended periods of time, like you said, those muscles will tend to shorten and contract as well. The iliopsoas is a big muscle, or a couple muscles, that will run from the femur itself, basically on the front of your leg, to the lumbar spine. So especially when those muscles are tight, it's pulling that lumbar spine a little bit more anterior as well. So it is actually pulling on the low back from the front portion of your leg, basically.
So the pain is from that pull, from the pelvis that tilts a little with the pull, the lower back curves in properly with the pull.
So the biomechanics then get thrown off too. So then you have that anterior pelvic tilt a little bit more. You're going to be basically contracting with the low back muscles to stand up a little straighter too. So then you have tight low back muscles at the same time. You have tight hip flexors. So definitely it could be a cascade of events at that point.
Yeah, without being with a good chiropractor, I would not have figured it out. I just kept doing back stretches, back strengthening, back stuff. No relief, not zero. Really frustrating until somebody educated me on what I shouldn't be doing and maybe what I should be doing. And game changer.
Oh, absolutely. Game changer.
Yeah. What do you do with infants? How the heck do you adjust an infant?
It's not the same as adjusting an adult. Basically, with infants, it could be just sustained pressure. So you're basically palpating throughout the spine. You're looking for different effects that the baby is kind of occurring with. But then basically the adjustment is going to be very gentle pressure, maybe a little bit of vibration with the hand too. And then basically it slides right into place. It's very easy to go ahead and move those vertebrae because nothing's fused yet. There's nothing there's no cartilage kind of through that region yet that's kind of holding that basically like an adult. So very, very simple, very easy to go ahead and adjust infants by hand. You could also use an activator, which is an adjusting instrument, which basically looks like almost like a pen where you're basically clicking on particular areas of the spine as well to go ahead and get some movement into that joint.
Well, my wife had our daughter-in-law take an infant son in because he was having digestive issues.
Oh, yeah. All the time.
What the heck is that about? Got the adjustment. Things cleared right up once a skilled physician got involved. And it was a pretty gentle outing. It wasn't as jarring as what I need, what I go through.
Definitely.
Actually, what I appreciate. Something very gentle, and a little guy, boy, he just recovered in a hurry. Everything started working properly.
The nervous system. Yep. Taking that interference away from that nervous system is going to help the function of wherever those nerves are going to basically function properly.
How did you get on this path? How did you end up a chiropractor?
Yeah. Well,
what got the path?
Well, when I was in undergrad, I didn't really know which route I wanted to take. I knew I wanted to help people, and I was in the exercise science department. We had a bunch of different practitioners from different fields come on and talk to the class. Thought I wanted to be a dentist. Went to shadow a few dentist office, thought it was like watching paint dry. It just was not for me. Might be for somebody else. I had no interest in it. And then a chiropractor came into our class and spoke about basically his story and how he's treating people without the use of medications and surgeries. He's basically trying to steer away from that and treating them in a holistic manner. And that really kind of stuck with me. And then at that point, I was just shadowing a bunch of different chiropractic offices, watching a bunch of YouTube videos on that as well. And I fell in love with it. The different stories that you've seen, or that not only personally that I've seen through practice, but basically beforehand, before I was even in school, just seeing the difference that it can make in people's lives in a holistic manner really kind of touched my heart. And I definitely wanted to go down that route.
That's great when you end up in a profession that you truly enjoy. I mean, dentist would have been great. If I had known back in college how much a dentist could earn, I might have been a dentist, and it would have been miserable.
Yeah. Oh, absolutely.
No interest at all.
Yep.
Somebody does. It would not be me. And that would be a poor choice for me. And it sounds like maybe for you.
Oh
It
yeah,
sounds like you're on the right path, right choice.
absolutely. Yeah, I look every day. I'm happy that I get to do what I do and help people every single.
Yeah. Did you work with any supplementation
Yeah.
for
Yeah.
your patients?
Yep.
How
So
do you do
kind
that?
of.
How do you
Yeah.
figure it out? How do you connect up?
So with that being said, definitely there's some functional medicine doctors that will have kind of blood tests run and things to that extent that they'll have a better kind of use for the supplementation. I basically go off the history of the patients that I'm interacting with. Whether if they're dealing with certain issues, then I'll be like, okay, well, you should probably take this or that. And so it depends like what they're coming in with. Usually I base it off of history or things that, hey, maybe they're deficient in this or that. So then I'll make recommendations off of that as well. I love using supplementation for kind of muscle tightness, things like that, or anxiety, stress, or even just general immune health too. So basically being able to recommend some standard process supplements was what I recommend in my office to my patients. But that's basically what I would do.
All right. For folks watching this, they may not have heard of standard process. Why can't they just go to Costco, buy some Kirkland brand vitamins? What's the difference? Why standard process?
The difference is what's in actually the process of making those supplements as well. With standard process, you're getting it from one place. No, it's all organic. You're not putting any pesticides in the foods or the plants or anything like that. That it's basically made to then make that supplement. But basically, it's trusted, reputable, and that's something that throughout school and coming out of school, basically, I've always used standard process, and I see such a difference between that brand and then if I'm using just a general store brand, you can kind of tell the difference once you're actually taking those supplements.
Oh, yes. Son-in-law of mine, a while back, decided it was time to start taking supplements. So he went to Costco, bought Kirkland multi-pack,
Mm.
and he thought it was just hilarious. The next day, he said he peed, and it was just bright yellow. He thought it was awesome. Showed somebody work. This is awesome. It's like cartoon pee. And he's a funny guy. So he's telling me about it later that night. I said, yeah, that's awesome. But that means that's not being absorbed.
Yep.
You're taking in a whole bunch of stuff, running it through your organs and right out of your body because it can't be absorbed. For instance, some form of calcium, if you get a quality standard process supplement, the calcium is absorbable. If you want a cheap form, like calcium that comes from rocks, you could get that in your Kirkland vitamins and it won't be absorbed. It doesn't do anything with the body. It just passes right through.
Oh,
It
yeah.
doesn't do any good, might even do some harm, depending on what your body needs.
Definitely.
Yeah, that makes a heck of a difference, the supplementation. Now we find, because we're dealing with, our clientele is chronic pain.
Mhm.
Most adults in America are deficient magnesium. And for some reason, I can't quite find the research to verify why, but magnesium deficiency is more acute with chronic pain sufferers. They can't seem to hold on to it. They can't quite get enough. So we do a lot with our topicals
Mhm.
to get the right form of magnesium. And then we add we add DMSO, dimethyl sulfoxide, which helps with the absorption.
Mhm.
We can affect things topically, but we can't do what you do, or you can attack internally as well, treating some of the symptoms, the inflammation, the muscle function. I think that's critical. I don't think it matters how many times I get an adjustment. If I can't get the muscles to let go around my back, then it's not going to matter. I'm not going to hold the adjustment.
Yeah. Yeah. Yep. Definitely see that the soft tissue work definitely helps hold the adjustments a little bit better. Can also help get those vertebrae to move a little quicker too.
Yes. So on the soft tissue side, do you have to sometimes dig into the tissue before the adjustment?
Yeah, occasionally on different patients, it's always different. Some patients I actually have to do a little bit of soft tissue work first to help loosen different areas up, just for us to get that range of motion to get the adjustment to go. And basically, other patients, it could just be lay on the table, we'll adjust you first, and then we could always finish up with soft tissue work as well. But it's depending on patient by patient basis too.
Okay. Well, I fall into the category of needing to get softened up a little, but that gets the job done. If I don't have that, it doesn't work. If I get it, it's awesome.
Yep.
Got to get an adjustment that actually works and actually holds because my own body's not fighting against the work that the physician just did.
Exactly.
Your practice, you're in Charlotte.
I'm in
You
more.
went to school somewhere warmer. You went to school in Florida, I believe, at Palmer,
Yeah, so I went to Palmer College Chiropractic in Florida.
but ended up in Charlotte. Why Charlotte? I mean, it's beautiful. It's a gorgeous place.
So
Love Charlotte.
originally, I'm from Long Island, New York. I went down to UNC Charlotte for undergrad, and that's how I became familiar with the area. Then when I went down to chiropractic school, I was looking around for different places to go ahead and live, and I loved this area so much. So particularly, I'm I'm about 35 minutes north of Charlotte in Mooresville, which is near Lake Norman. And I fell in love with this area, and I just wanted to be able to come back, set my roots here, and be able to help my community.
Awesome. And it's a great place to set down roots. It's a gorgeous part of the world.
Oh, yeah.
What about that?
Very easy to get from New York to Florida or wherever I need to go on the East Coast. So that middle.
As far as maintenance for yourself, I mean, you're in a physical profession. What do you do to make sure that you don't wear down? Because I've seen some chiropractors and certainly a lot of massage therapists that simply wear down, break down, run out of professional life because they're not doing maintenance.
Yeah.
What are you personally doing to make sure that you don't run out of steam or functionally just can't do this in a few decades?
Yeah. So I practice what I preach. I met my fiance in chiropractic school as well. So I'm constantly getting adjusted by her as well, getting some therapies done as along on that note. And then basically I'm always working out too. So I want to make sure that I'm staying strong, I'm staying fit, I'm putting good things into my body, good nutrients, so that I could be able to sustain my body for that long period of time as well.
You met your fiance in chiropractic school. I listened to a podcast you did not quite a year ago. She was a girlfriend then. So apparently you've progressed.
Yeah. Yep. We
That's
progressed
awesome.
past summer. I thank you. I appreciate that.
Yeah, that's cool. And it's nice to have somebody in-house that can kind of help out.
Definitely. And then
Pretty
always
darn important.
someone good to bounce things off of as well. Someone who knows what I'm talking about. So yeah, that's game changer.
Where does she practice?
She practices in Huntersville, which is about 10, 15 minutes south of where my office is.
Not bad. Suppose you'll ever practice together?
Eventually, I would like to. Right now, just still in that growing phase. So we'll see where time takes us. But definitely, I would like to kind of bring her on board as well, be able to treat as many families as we can in the Lake Norman area.
Very nice. Do you have other professionals on staff doing other things besides what you're doing?
So no, it's just me. I'm basically renting space out of a physical therapist gym. So if we ever need to basically work together on a patient or anything like that, I can basically go next door, knock on his door and say, hey, this is what's going on. I think they need to help this and this. Would you be able to help me out?
My main chiropractor, I saw it just a couple of days ago in the same building. They have PT. It's part of the same group. And occasionally they pass me back and forth depending on what I'm up to.
Definitely.
And that is phenomenal because there's some things you can do with an adjustment and coaching and training. But sometimes I just need coaching from the PT that I can take to the gym that I could be doing every day on my own. And the PT is great. It's odd. I occasionally see orthopedic surgeons that kind of poo-poo the whole physical therapy idea. And I think that's just nuts. Same thing with some orthopedic surgeons that downplay chiropractic. Again, that's just nuts. The better ones that I work with, they embrace chiropractic. They certainly embrace PT because those surgeons get to look brilliant and do less work.
Yeah.
It really has to be the team, kind of like what you're doing with your PT there in the same building. That's great.
You also have to find the right providers. If you go to a very insurance-based practice for PT or chiropractic, you might not be getting the same services or basically what you're looking for with an out-of-network provider as well, or just basically it depends. So if you go to one place, you're never going to experience the same thing if you go to the other. So I'll leave it at that, but basically know what you're looking for. I know some people, it's hard to know what they want to look for, but being able to not only have the education, the background, but being able to see kind of the reviews of what other people have experienced too makes a huge difference.
As far as insurance versus cash pay, what percentage of your practice is insurance? What percentage is cash pay, roughly?
Insurance, 0%.
Really? One of those rebels.
What was that?
One of those rebels.
Yeah. So, rebel. But basically, I want to be able to provide what I know is going to help my patients. I don't want to have to go to the insurance company. Hopefully they get cleared for this type of procedure, or if they don't get covered for this modality where I know it's going to help them, or let's say they come in with an ankle injury from the weekend or anything like that, I'll be able to go ahead and directly treat that rather than have to wait for the back end of insurance, see what they cover, what they don't cover. So basically, I want to be able to provide everything that I can for my patients to help them see them excel as fast as possible.
Of that, actually. I don't think it's healthy to have some bureaucrat in a cubicle dictating your patient care, your patient protocols. That is not a great way to practice medicine. In fact, that's why a lot of my MD buddies are just plain frustrated.
Mm-hmm.
What they can or can't do is often dictated to them by the protocol. In fact, we saw some of this with COVID just a few years back.
Yeah.
Much of what the physicians were able to do and say was dictated to them.
Mm-hmm.
And if they varied from that, they were heretics. And some were threatened with actions against their licenses just because they wanted to treat a virus as a virus.
Definitely.
And I see the same thing with PT. I see the same thing with chiropractic.
Mhm.
The chiropractors that I work with, PT I work with, cash basis, and they're doing what I need.
Yeah.
Not being dictated.
Mm-hmm.
That's awesome. Glad you did that.
I appreciate that.
Brave, crazy way to go, but it's the right way to go.
Brave
because you can it's medicine.
Absolutely.
It's awesome.
Thank you.
All right. Before we wrap up, any words of wisdom as far as how people connect and why they connect with you? Any closing thoughts?
Well,
I think people
they can connect with me on social media, Live Well Chiropractic PLLC. You can go directly to our website at livewell-chiropractic.com. If you want to come to me, just know that you're going to get a great experience, that I'm going to look directly into what's causing your issue itself, or basically just trying to make you feel as good as possible for extended periods of time. And then basically I'm an open book. I tell all my patients that. So if you have any questions, feel free to ask me. I will answer back to you as soon as I can as well.
Okay, running through that website in the show notes. And folks, if you go there to the website, you see all the connections to social media. And Dr. Austin has built out some great tools, great thoughts, great guidance, really useful.
Thank you.
It's not like some social media that's just kind of flashy, a bunch of pictures. There's actually usable, learnable content. So yeah, I'd be going there. I think it's great. You're doing a heck of a job there, especially since you're doing a lot of that yourself. It looks great. I don't know who you're using for filmography and content, but it's good. It's top notch.
Yeah.
Well, kudos to you. Take off one hat, put on another. And it's working. Yeah, I love it.
I appreciate that.
Very good job.
Thank you.
All right. Well, I appreciate the time. It's good to have you on the show. And I love your apprach to practice.
Thank
I think
you.
that holistic, that broad approach, it's great. It serves the patients well.
Start holistic first.
It's about that. It's about being well. It's not the sickness model that I see with my MD buddies. It's the wellness approach.
It's healthcare, not sick care.
That's right. Healthcare, not sick care. Well, that's awesome. Well, appreciate your time.
Thank you, Todd.
Hang around just a couple of minutes here.
Absolutely.